Okay, so let's look at the muscles of facial expression. The first muscle we have what? We have the occipitofrontalis muscle. It has two bellies, the frontal belly and the back here is the occipital belly. And so these two bellies attach to galea aponeurotica, right? So basically it constricts the galea, okay, and therefore, especially the frontal belly here, it has this, when it constricts, okay, so everybody do it. So you have these horizontal lines at the frontal. You see these horizontal lines here? Okay. So that's the horizontal lines. Yeah. So do it. You do it. Do it. Everybody look at him, not me. Okay.
Yeah, I have a lot.
Okay. So that's frontalis muscle, or occipitofrontalis muscle. And then we have two muscles that is located in the around the eye. Okay, so we have the orbicularis oculi muscle. Okay, that's one of the obvious muscles that we have here. Orbicularis oculi muscle. Okay, who wants to look at this? Orbicularis oculi muscle. And then we have the orbicularis oculi muscle. We have three parts: the orbital part, right, palpebral part, and then we have the depalpebral or the lacrimal part. So the orbicularis oculi muscle functions in what? Closing the eye. Okay. This is also referred to as like the constrictor. And then we have the palpebral part. It's also closing, but that's like something like blinking. So the orbicularis oculi constricts and you voluntarily close your eyes. And the orbital part, the palpebral part is just like blinking constantly. And then we have the depalpebral, the deep orbital or the palpebral part, depalpebral or lacrimal part. It's located on the medial side. It's deep. Located on the medial side. It's associated with the lacrimal bone and attached to the upper and lower eyelid. And there it's where you have the lacrimal sac. Lacrimal sac basically constricts the lacrimal sac and it pushes the tears towards the canals. And also, you also have you have this superior and inferior canaliculus, where the tears go through this canaliculus, opens the sac, and sac opens to the nasal lacrimal duct, and duct opens to the nasal cavity. So both the palpebral part and the lacrimal part, basically they act on squeezing these ducts. They squeeze these ducts and the sac, and the tears basically moves forward. So if the orbicularis oculi, if it doesn't work, so what happens then? So if you have damage of this muscle, the orbicularis oculi, there's a damage or paralysis of orbicularis oculi muscle. What would you see in this patient? Okay, one, it can't close the eye. So you would ask question, for instance, close your eyes. And so he can't close it. And then what else? Second?
So the eye will tear.
Right, the tears would basically droop down on the cheeks. Okay, they would basically flow on the cheek. Okay, why? Because these muscles would not push or compress the canals, so it won't go through these canals and towards the exit. So it would overflow, and it will droop and flow on the cheeks. So so what nerve would be damaged? Would you see a damage on which nerve? Okay, facial nerve, but so right. So specifically speaking, we have partially the temporal and zygomatic branches. They give branches that supply the orbicularis oculi muscle. So we have the temporal, and zygomatic branch of the facial nerve. So if that's damaged, okay, and so you might see a full damage of the facial nerve. So where would you see a full damage in the facial nerve? Where might you see a full lesion of the facial nerve? In the maybe? In the gland, right? What gland is this? Parotid gland. So you might, so there might be an inflammation there, then that might affect the facial nerve inside the parotid gland. Or, so facial nerve comes out from the skull, or enters inside the skull from the brain stem. So it enters, where does it enter? In the temporal bone. So it comes out from the brain, okay, from the brain stem, and it enters a foramen in the temporal bone. So what foramen is that? Remember? Internal auditory meatus. Remember that? So you have the internal auditory meatus. We have the facial and vestibulocochlear nerve. Remember, 7 and 8 cranial nerve passes through this meatus, internal auditory meatus, along with the labyrinthine artery. Internal auditory meatus in the skull, right? Remember? So it goes inside the petrosportional temporal bone, and from there it supplies the middle ear, gives the branches. No, you don't have to know this right now. And then it exits the skull through stylomastoid foramen, right? So we have the stylomastoid foramen. So it's right about here. So we have the styloid process, and we have the mastoid process. In between, we have the foramen, which is referred to as stylomastoid foramen. So it comes out from here, the facial nerve. So basically, there might be a stenosis, a constriction of this foramen. Okay, so there might be an excessive amount of bone formation or inflammation or somewhat. Okay, so as it passes through the stylomastoid foramen, it might be damaged, affected. Okay, there might be a lesion there. So, and then there might be something wrong, something happening inside the parotid gland, like I said, inflammation, or a tumor that would compress the facial nerve, and that would affect the orbicularis oculi. Along with that, so we call this as what? What we call that totally? If there's a lesion on the facial nerve that affects the facial muscle expression, facial expression. Bell's palsy, right? So all the total effect of this is referred to as Bell's palsy. And one of the symptoms is basically connected with the inactivity of the orbicularis oculi muscle. So let's look at the other muscles now, and then we have the corrugator supercilii, and then we have the procerus. Now, corrugator supercilii is like above the eyebrow here, and procerus starting from the bridge of the nose and attaches to the eyebrows, okay? And these two muscles primarily involved in, or produces what? Frowning. Frowning. Okay, everybody do the frowning. Okay, that's frowning. Everybody do it? Oh, that's good. Yeah, do it. You see it? Look at her. Can you show her? Okay, do it for look at the camera. Do the frowning.
I did it.
And do it again. Stay like that for a while. Okay, good. let me see you guys do it. Good. Do it. Do it. No. Can you do it? Okay, good. Okay. So that's frowning. So we have the procers, and corrugator supercilii does these similar activities. So if you want to do a Botox, so you have to do where? In this area, right? So that area is basically referred to as the glabellar complex muscles. Glabella. So basically these are located in the glabella area, both procers and corrugator supercilii. Okay, so you have to do Botox in the glabellar area, and this area is formed by the